So let's go ahead and get started. Welcome everybody to our session. Thank you so much for joining us. Thank you to CUGH for hosting us. My name is Susie Pollard. I'm a program officer in the Division of AIDS Research and a member of the NIMH Global Mental Health team. We're really excited to have the opportunity to both share and learn from you all. This is one of several ways through which we at NIMH are hoping to hear from the research community about current gaps and opportunities in global mental health research, with a particular interest in training capacity building to help inform our strategic thinking at NIMH. One of our goals and commitments really is to foster opportunities to enhance the diversity of our research community in a way that's equitable and inclusive. So some logistics, I wanted to go over a few of them. So firstly, a reminder that the session is being recorded and will be posted online through the CUGH website at a later date. Please keep your microphones muted. Since this is a big group and a tight agenda, we want to minimize any interruptions. And since we have such a large group with us, we unfortunately also won't be able to have people speak on camera from the audience. So please place questions or comments in the chat function as we move through the different sessions. We'll also be sharing some links and contact information in the chat throughout the day. So keep an eye out for those. I wanted to walk you through the agenda really briefly. The first hour, we'll hear from NIMH representatives, including Dr. Leonardo Cubillos, Director of the Center for Global Mental Health, Colleen Lawhorn, Global Mental Health Team Lead, and myself about the priorities, activities, and opportunities in mental health research at the NIMH. There'll be a brief Q&A at the end, moderated by our own Dr. Aber Wuhib. In our first panel, moderated by Dr. Mauricio Angel Gomez, we'll hear from Victoria Cavero, Liliana Hidalgo, Walter Manghezi, Rosemary Musasengwa, and Annette Sohn about mental health research capacity building programs across the globe. And in our second panel, moderated by Dr. Paul Taylor, we will hear from Dr. Barathola, Lola Kola, and Evan White around challenges and opportunities for developing a career in mental health research. And finally, Dr. Cubillos will end the workshop with closing remarks. Lastly, before moving on to our first speaker, I wanted to leave you with a few announcements. Please be on the lookout in the next few months for an announcement and invitation to our NIMH Global Mental Health listening sessions. It'll be an opportunity for you to share your perspectives and experiences carrying out mental health research. We'll cover a wide variety of topics, including institutional capacity building, training, research careers, mentorship, grant applications, partnerships and collaborations, among other things. We also hope to hear from many different groups involved in mental health research, from investigators at different career stages to grants administrators, policymakers, and research staff. They're intended to inform future strategic planning initiatives and resources around mental health research, training, and capacity building across NIMH. Individuals and institutions with and without a track record of NIH funding will be encouraged to participate. We also have an active request for information, or RFI, out. It's around gaps and opportunities in global mental health research as well. And we're requesting written responses by May 5th. And please save the date for the 2023 Global Mental Health Research Without Borders Conference, held in person at NIH on October 30th, 31st, and November 1st. Conference details are coming soon. They will be found on the CGMHR website, which we'll also put in the chat at the end. But please also consider submitting an abstract for the contents, which will be due in late May. And I'll leave you with a plug for our newsletter. You'll also see information about the conference through this newsletter, which you can sign up for by emailing gmhcommunications@nih.gov, and also leave you with my contact information. And without further ado, I will pass it off to our first speaker, Dr. Leonardo Cubillos, Director of the Center for Global Mental Health here at NIMH. Thanks, everyone.
Good morning. Susie, am I on camera and can you hear me?
Yes.
All right, thank you very much. Thank you everyone for attending today's session. Thank you for the Consortium of Universities for Global Health for hosting us. Thank you to the panelists that accepted our invitation, and to all the attendees of this morning or this afternoon or this evening, wherever you are in the world. A special note of gratitude to my colleagues at NIMH who put together these virtual workshops. Some of them you will be seeing today on camera. Many of them are working behind the scenes to make this possible. So thank you, all of you, NIMHers and non-NIMHers who are involved. My name is Leonardo Cubillos. I am the director of the Center for Global Mental Health Research, and I will be speaking to you briefly about the Center for Global Mental Health, our priorities in research and in other domains. And I will be here throughout the session, learning from you all and contributing to the session as well. So without further ado, I am going to share my screen. Make sure that it is visible. Susie, can you see my screen?
Yes.
All right. So a little bit about NIMH and global mental health. Global mental health is one of the cross-cutting priorities within NIMH, whereas the NIMH has a Center for Global Mental Health that I have the honor to lead, and I will be speaking about in a few minutes. There are other divisions within NIMH that also have work in global mental health, either in the basic arena or in the translation arena or in the HIV field. So it makes justice, or it does justice to the fact that it is a cross-cutting theme, along with others such as prevention, environmental exposures, comorbidities, and computational approaches. The slide you see here is a snapshot from our strategic plan that we update every year, that we invite you to consult. And as Susie mentioned at the end, we are eager to hear from you as part of the process of the request for information that is due on May 5th. We want to learn from you what you think are the priorities for global mental health, so that in turn we can, enrich this strategic plan and our actions that follow the strategic plan. So in the context of how much we prioritize global mental health, we think of the research in this area in three domains: discovery research, which is basic research that may have a longer term impact as far as patient care is concerned. We have translational research, which can have a medium term impact, and we have a services and intervention research or implementation research that can have a near term impact. In all of them, we encourage engagement of diverse populations, communities, and contexts. For example, our basic neuroscience division has a beautiful network throughout the world, trying to understand the genetic contributions to different mental illnesses in non-Caucasian population. So it works in different countries around the world, trying to understand the particularities of this population and its genetic background. And in all of these cases, we aim to expand the research capacity in low and middle income countries, as well as in low resource settings in underserved communities. However, what do we mean by research capacity and how can we do it better? Well, this is what we're here for. We're here to learn from you and to learn with you. As far as the center is concerned, we focus on near-term and medium-term translational and services research. So research that has the opportunity to impact the service delivery in a number of years, in short-term number of years. And we're talking about different areas that I will speak briefly. The Center for Global Mental Health, along with other divisions and offices within NIMH, came together to join a larger team called the Global Mental Health Team. This Global Mental Health Team, you can see here around the globe, different divisions and different offices. This Global Mental Health Team has three priorities. I will not go further into this because my colleague, Pauline Lohorn, who will speak right after me, will delve into the global mental health team. But I just want to stress that many people with different backgrounds, with different interests in research within NIMH are working on global health matters as part of the global mental health team. And the center is one of them. The center focuses its funding opportunities on increasing the body of evidence necessary to inform decisions concerning the adoption, potentially adoption as well, but also scaling up of evidence-based interventions in low and middle income countries. We are constantly looking at that mental health access and quality gap that is well documented, and we want to fund research that helps us close the gap in terms of accessibility, availability, acceptability, affordability, and quality of interventions, all the way from preventive to rehabilitative, including, of course, diagnostic and therapeutic. That is one of our first priorities. This line of research, closing the mental health gap in the dimensions I just mentioned. The second is, of course, building or strengthening the research capacity in global mental health within low-income countries, middle-income countries, and high-income countries. And that's why we are here. And the third area is encouraging the potential to learn from each other, what we call at NIMH reciprocal learning, but others call reverse innovation, or south to south, or north to south, or reciprocal innovation as well. It is just the fact that we can learn from each other. High-income countries can learn from low-income countries. Middle-income countries can learn from low-income countries. And encouraging this multi-directional exchange is very important for us. So capacity building, as I just said in the previous slide, is one of our priorities. We want to do more, and we want to do better capacity building. We want to learn more of how others do it. And that's why we have sessions like this, as well as the listening sessions that Susie just mentioned, and all the different activities that we will be hosting throughout the year, including in the October conference, the Global Mental Health Conference that NIMH welcomed the International Alliance for Global Mental Health Research Funders and GCC, the Grand Challenges Canada organization, are bringing together. So remember, capacity building is one of our areas of emphasis. And in research, I mentioned that we want to close the mental health gap, access and affordability and quality gap, but we're focusing within that context in 5 research domains: suicide prevention, integration of mental health care, social determinants of mental health, human mobility and mental health systems, and of course, training and career development as part of also research capacity building. Of course, research capacity building is not only the domain of that training career development. We want to encourage that within all our 5 other programs. And as you can see in the context of suicide prevention and mental health systems, both of them are part of the Sustainable Development Goals, and specifically of the 3rd Sustainable Development Goal. We have an emphasis on implementation science because we want to address as quickly as possible that gap that I've mentioned multiple times already. We understand the power of data science. That is, there is a lot of data out there, administrative and non-administrative data, that we can mine to benefit the populations we serve. And of course, digital technologies. And I think in the context of this audience, I need to explain the importance and potential of using digital technologies. Just an example of something we funded a number of years ago in 2015 and 16. These are called the research partnerships for scaling up mental health interventions in low and middle income countries. These are 10 research groups funded throughout the world, all the way from Latin America to East Asia, in different topics, all the way from adolescent and child mental health care to care of dementia, like you can see in Thailand and China. And the goal of these scale-up hubs, as we call them, was to help address implementation questions to scale up these evidence-based interventions. Many of these hubs have been very successful. We are gathering lessons learned. And as early as 2 or 3 weeks ago, The Guardian, this prestigious daily outlet in UK, posted a news article on the hub in India. But you can find articles all over PubMed about these different scale-up hubs. So I want to conclude this slide inviting you to visit our website. Susie will list in her coming presentation the different announcement opportunities that we currently have out there, some specific to the center, some broader in the context of NIMH. But I want to thank you for your time, and I will be here throughout this session learning with you and learning from you. So see you in the coming 3 hours as well. Thank you so much, Susie, and I'm passing it to my colleague Lowhorn.
Okay, great. Thank you so much for that, Leo. I'm going to share my screen and talk a little bit about NIMH, and in particular, share a little bit about our global mental health team. So let's see which screen I'm showing. I believe it's this one. Okay, great. All right, so that I've called this short presentation, NIMH Global Mental Health Team, Research Prioritization Without Borders. And I think you'll see why as I go through it. But the team is really a place that we consider to be a group without borders, in that we are able to enrich the global mental health space through the many, the various levels of expertise that we bring to the table. So I'll walk us back a little bit, because I think it's easier for me to drill down into who we are by kind of explaining our big picture first. So many of you may know that NIMH, the National Institute of Mental Health, is one of 27 institutes and centers, we call them ICs, that make up the National Institutes of Health. And here we are in this brownish box on this org chart. NIMH is the leading federal agency for research on mental illness. We support more than 3,000 research grants and contracts at universities and other institutions all around the world. And we also have an intramural research program. Those are folks who are doing mental health research right on our campus, and that's made up of about 600 scientists. And on the left, I'm showing various images. One is a screenshot. One is an image of our main campus at the National Institutes of Health. And then the other two make up images of where our extramural research program sits, which are folks who help manage the research activities at grants and universities. And the other represents a place where many of our intramural researchers sit, who are actually conducting mental health research on campus. As Leo, my colleague, just shared, the NIMH is guided by a strategic plan that represents complex behaviors underlying the brain. So some of our basic mechanisms, looking at mental illness across the lifespan, looking at prevention and cures, as well as services and intervention research. And we do this through a number of different divisions and offices. I'm showing them here on the right. And the Center for Global Mental Health Research is in a lighter blue. And these make up what we call the many of the research making bodies of the Institute, as well as our intramural research program and our division of extramural activities. In addition to that, to add to that complexity, we have a number of cross-cutting offices, which also contribute to various goals and have different prioritizations for how we do business. And so among all of that, our director several years ago, Dr. Joshua Gordon, decided that we wanted to, NIMH should develop a way to think about some of these cross-cutting research areas that really leverage the expertise of people in those individual divisions and offices, that we might be able to work better together and faster together if we could develop a system or an organizational structure by which we could all contribute. And as such, we had our team structures that were born. So these cross-cutting areas or teams represent, these are just a couple of them, there are actually more, but some highlighted on our website are the suicide team, suicide research prevention team, genomics team, mental health disparities team, and the global mental health team. And that's what I'm here to talk about today. And the Global Mental Health Team's goal is to support global mental health research to help drive innovation and advance solutions using an integrated organizational approach that leverages the broad subject matter expertise and cross-cutting skills of folks across our institute. And this is us. This is not all of us, but this is a screenshot from a recent meeting. Just re-highlighting our title now that you got a sense of our organizational structure, that we prioritize our research with some consideration of the organizations we're in, but really this is a place to reinvent and to feel that we can move forward without the structural borders of our institute. And we do this again across many divisions and centers, offices. Many intramural researchers participate on our team, all working towards our NIMH mission. These again are the offices and divisions that make up the Global Mental Health Team, all collaborating on a regular basis to cultivate our diverse perspectives and really open up those institute-wide channels of communication. Our Global Mental Health Team specifically works on our internal audiences. So how do we communicate within NIMH? How do we provide support to our colleagues across the Institute around global mental health issues? How do we provide professional development opportunities for individuals who may not be focused on global mental health as a part of their day-to-day functions, but want to be able to grow in this space? How do we provide, we also provide technical support and insight about the applications that come in to our director for decision-making, and also coordinating a number of science policy related topics and issues that come forward through our Fogarty International Center or our HHS Health and Human Services Office of Global Affairs or other entities. We work very closely with the Center for Global Mental Health Research, which my colleague, Dr. Leo Cabillos, just described. And just to put this in the context of how the team works, we think of our center as the folks who are engaged with our external audiences. These are people who are maintaining the research portfolio and working with the PIs, many of you that are on the call. These are the folks you'll see at those federal government engagement opportunities. So working closely with our State Department colleagues, our USAID colleagues. Our center staff are also the points of contact for science diplomacy. And while I think all of us are engaged in science diplomacy in one way or another, when there are high-level meetings with various international governments, you'll see our center staff participating in those, as well as our multilateral partnerships with WHO and UNICEF and the World Bank and others. And here I'm showing an image of two site visits by our center colleagues. Here, second from the right is Dr. Leo Cabillos, who is leading a site visit with our director, Dr. Joshua Gordon, our Division of AIDS Research Director, Dr. Diane Rausch, and colleagues from Thailand on topics related to global mental health in Bangkok, as well as our head of mobility research, Dr. Holly Campbell-Rosen, who is participating with colleagues at a site in India. And then I'm just showing a quick Venn diagram of our shared responsibilities. And really, we all work together to prioritize research planning. We all conduct scientific outreach and work on hosting events. And we all participate in the scientific direction, some of which directly involves developing funding opportunity announcements, which we call NOFOs, and or contributing to the science that would help drive the field forward. And so again, we do have our lanes that we like to stay in, but I like to say we're more points of contact in those lanes, and we all work together very closely. The last few things I'll share is how we organize in terms of specific scientific goals. We have a strategic engagement working group, And that really is around promoting and elevating our global mental health research priorities and opportunities. This is around trying to implement some of the research goals, largely through learning exchanges and knowledge exchanges. And here is a fantastic opportunity we had to host, in this image, Ms. Deborah Castell from the WHO. And that was a fun way for our team to get together. And she presented an outstanding presentation to our wider NIH community. Another team a sub-team that we have in the global mental health team is our reciprocal learning working group. And this group is really about communicating the importance of multi-directional exchanges, identifying methods and approaches and interventions that could ultimately help advance the field by sharing strategies for optimal implementation. In this image, some of the global mental health team members are at a site visit with a team from Washington University at St. Louis, and discussing a reciprocal learning project where fellows participate in activities and research in a Ugandan setting, and here we're at Makerere University in Kampala, as well as low resource settings across the United States. And finally, I'm really excited to be able to give a small share a small piece about what our capacity building team does. And this group is really aiming to gauge and develop projects that will enable the performance of high quality mental health research and practice, with a particular focus in low and middle income country settings. They're about strengthening sustainability and equity along the research training pipeline, effective mentorship, building institutional research capacity, and forging equitable partnerships and collaborations. And we're showing a site visit by our Dr. Abir Wuhib, who was doing some capacity building activities for mathematicians in Ethiopia. And I'm especially excited to acknowledge this group because this is the team that put together today's very important satellite session, who worked very hard behind the scenes to be able to bring this forward to this international group today. So I really thank them for their dedication and support. And as you've heard several times, because we're super excited about hearing from you, please go and visit this website to be able to respond to our request for information. This is really going to help us hear from the field and think about ways in which we can be responsive to the needs of the field. So with that said, I'm going to stop sharing. And I think I'm turning it over to my colleague, looking at my agenda.
I'm
Turning it back to Susie, sorry.
Oh, okay. Well, thank you so much, Colleen, and thank you, Leo, for your presentations. Hi again, everybody. Again, I'm Susie Pollard. I'm a program officer in the Division of AIDS Research. And I'll be providing a very brief overview of the training and capacity building funding opportunities that are supported by NIMH. I am presenting on behalf of just Dr. Susanna Allison. She's the training director for the Division of AIDS Research and the Center for Global Mental Health. I will do my best to answer questions, but I will also provide Dr. Allison's contact information at the end, so that you can reach out to her with any additional questions. You're also welcome to reach out to me and I will guide you to the right person. And again, we will be putting all the links that I'm going to mention during this chat, during this talk in the chat function at the end. So if there's one message you should take away from this brief talk, it's to contact us. And by us, I mean the training director, Dr. Allison, or appropriate program officers early so that we can provide assistance prior to submission. We can help guide you so that your application meets referral guidelines, aligns well with institute priorities, and uses the funding mechanism that's most appropriate for your research. I also want to guide you to our webinar series, the first 7 of which were held in 2022. All the recordings can be found at this link. The sessions cover all steps of the grant process, from submission and peer review to training mechanisms available at different career levels, to writing a successful grant application and post-award considerations. Please jot down the website. We'll put it in the chat at the end as well, because here you'll find more detailed information about each of the mechanisms that I mentioned today. And they're a great resource, and they're there for you. You can also check out researchtraining.nih.gov for more training opportunities and resources. So this slide has a lot of information, but it's a brief overview of the NIMH supported funding opportunities that are available across different career stages. So from undergraduate all the way to early career investigator. And on the right, you can see the mechanisms that are relevant to citizens of countries besides the United States. While the primary funding for most of these mechanisms comes through the Fogarty International Center, we at NIMH work closely with them and participate in all of these mechanisms and can provide co-funding. So some mechanisms to highlight here, and I'll also describe them a little bit more, are the D43 programs, including the Launch Non-Communicable Diseases and HIV D43 programs, the K43 Emerging Leader Award, which is for early career investigators, as well as several of the R or research funding mechanisms, including the R03, R21, R34, and R01. So all of these are available to for applications from citizens from other countries. This is just another way to kind of view those NIMH supported training opportunities on the previous slide across different career stages. And the mechanisms that are highlighted in red are the most relevant to applicants from LMICs. And I wanted to begin by briefly touching on the institutional awards open to investigators from LMICs, so specifically the D43 programs. So with respect to the D43 programs, I wanted to start by saying that if you're interested in participating in one of these programs as a pre-doctoral or postdoctoral or post-professional trainee, the way this works is that you would need to contact the specific program directly. So they're located at different institutions across the world. Each of these programs has their own processes for selection and placement. You can find and search for different programs at this link. It's a long link there, so I created also a shorter link for you to use. And again, we'll put this all in the chat at the end of the talk, and you'll be able to access this information more easily. So the first of these D43 programs I will mention is the Launch program. Led by the Fogarty International Center, and it supports 1-year mentored research training in global health at established biomedical and health research institutions and product sites in LMICs. The Launch grants provide opportunities to pre-doctoral and pre-professional trainees from the US and postdoctoral and post-professional trainees from the US and LMICs. And they cover a broad areas of research that are supported here. So both non-communicable diseases, communicable diseases, and all of that also includes mental health. NIMH also participates in the non-communicable disease and HIV D43 programs. The chronic non-communicable diseases and disorders across the lifespan program aims to sustainably strengthen the research capacity of LMIC institutions and to train in-country experts to conduct research on chronic non-communicable diseases and disorders. And this includes mental health. The HIV D43 program aims to strengthen the human capacity to contribute to the ability of institutions and LMICs to conduct HIV-related research. And this includes mental health comorbidities, which is why we also participate in this program. And all of these programs, they provide opportunities ranging from 1-year pre-doctoral or postdoctoral fellowships to short-term training opportunities for LMIC researchers, depending on the program. I also wanted to bring attention to the opportunities that are available for early career faculty and postdoctoral fellows. So the individual mentored CUGH support for intense career experience and the transition independent research intensive by the end of the board. There are several mechanisms, but I'm going to highlight the 2 K award mechanisms open to non-US investigators. And as I mentioned previously, one is the K43 Emerging Global Leader Award, and the other is the K99R00 Pathway to Independence Award, which is available for postdoctoral fellows. Either citizens or citizens, but you would need to be based at a United States institution. So the K43 award is specifically designed to support individuals from a lower middle income country with a junior faculty position at an LMIC academic or research institution. And here you can see the relevant mechanisms or PARs. Again, we'll post these at the end. And here you can see some of the pertinent program features of the K43 award. It's open to LMIC citizens with a position at an LMIC institution. It provides up to $75,000 for salary and $30,000 in research costs per year for 3 to 5 years of mentored research and career development. Christine Jessup at Fogarty is the main contact for this mechanism. And her email is listed here. So for any additional questions, you can email her. And the K99R00 Pathway to Independence Award is designed to facilitate, again, the rapid transition from a mentored postdoctoral position in the first 2 years to an independent research position. Again, available to both US and non-US citizens, but at United States institutions. It provides 2 years of postdoctoral support up to $100,000, followed by 3 years of faculty support up to $249,000. Lastly, for those of you who are interested in applying to the R series grants, which are focused on research projects as opposed to training specifically, we have several active funding opportunities, including requests for applications focused on effectiveness and implementation research for post-acute interventions to optimize long-term mental health outcomes. Also, one around suicide prevention across the lifespan, and one on developing measures to advance access and equality in global mental health services. This is a lot of information to take in all at once, but take-home messages are to, again, reach out to a program officer or the training director early on if you do have any questions. That's what we're here for. We also recommend that you find a scientific mentor, perhaps one aging. And so you can also reach out to us and we may be able to help think through that. You can start with Dr. Allison for questions, but whose contact information at the end, or myself know where to start. And again, please check out the CGMHR recorded webinars for more detailed information about everything that I mentioned today, including several other important topics. So thank you very much. I corrected the GMH communications email here. So it's, if you want to sign up for then GMH communications@mail.nih.gov. And the contact information for Dr. Allison is allisonsue@mail.nih.gov. So thank you. Thank you very much.
All right, good morning, good afternoon, and good evening, depending where you are. My name is Abar Rawi from National Institute of Mental Health, and I'm moderating this particular session. First of all, I would like to thank my colleagues, Dr. Pollard, Dr. Kubilius, and Dr. Lohan, in no order, for their wonderful presentation. I really appreciate that. And I really encourage everybody to put their question so I can really refer it to the person whom you are asking. And I believe most of the probably your potential questions would be answered in the link if you in the chat and you can see the link. So that would probably answer most of your questions. So I'm looking for that. And I see one which says that, I think this would be, whom should we contact? That's one question I saw. We got, who are the program officers, with respect to, those information you provided to us. Is there any specific program officer that we have to contact or anybody? That's the question, and probably that can be answered by Sylvia.
Right, yes. You can, there are specific program officers that are that focus on particular areas. For example, mine is in implementation science, HIV, but it can be, I know that it can be hard to find the exact right person. So you can contact me or you can contact Susanna, Allison, and we can always try to direct you to the right person. So I think the simplest thing is to contact one of us. Okay.
And the other question I see is, I don't know if it was answered, but are all NIH awards are institutional, or do you really award just individuals?
If we do award to individuals, is that your question?
Yeah, or the awards have to come through an institution.
Oh, well, I guess, the individual applicant would need to apply through their institution. So the institution, you would need to work together closely with your institution to put together that application and submit it. So technically, it comes through the institution.
And there's also, follow-up question for you, Susie. Can Susie please drop her contact details? So that's your email address, I guess.
Yeah, right there. Yes. Mauricio just added it, so sure.
Okay, thank you. And there is another question. When choosing a U.S. primary mentor for K43 application, is this important for primary mentor to be affiliated with an U.S. institution that the application have collaborated with or have connection with?
Yeah, so that's not necessarily a requirement. It's the reviewers will evaluate the strength of the mentorship team, and I think it's important to have a strong presence of investigators from the country that you're from and where you're going to conduct the research on that team. I think that's an important thing. So the short answer is it's not a requirement for that. Yeah.
Okay, I think this one is for, I think this is for Colin, I guess, it came from, local university here, and it says, are there opportunity to join the reciprocal learning group as non-NIMH staff member?
Oh, I'm so happy to hear that someone is interested in our reciprocal learning group from outside of NIMH. Unfortunately, our group is specifically for NIMH staff. However, I do encourage you to consider starting a special interest group, perhaps at your university around reciprocal learning. many of the elements that we use to help guide the group will transfer to a number of different settings, and I don't think we can have too much of it. If you want to connect about it, I'm happy to perhaps connect you with someone from our reciprocal learning team specifically, and or talk a little bit about those elements, and maybe you could get one started on your campus.
Thank you. And this was really asking clarification, I guess. I don't know if it goes to suited to you, but it says, I wanted clarification on application status for some application. Do we have to affiliate it with a higher education institutions or like universities, or would other like church be applicable when we're talking about an institution?
That we have gotten questions like that before, and I don't know, Tamara, if you would have any. It's okay if you don't, would know for sure. It does not. There are definitely other, types of institutions besides higher education that have been able to apply for awards, community-based organizations, other research institutes. I guess I'm not 100% sure the specifics of this particular question. And so if you have questions about a particular case, you could reach out to one of us and we could kind of work with you to read through the funding opportunity announcement and look at the eligibility and kind of think through that question.
All right, Sue, thank you. I don't know if this one is for Leo or it says, I have been working in global mental health for 10+ years. And my work right now focuses around this global areas. So I'm interested in this topic and would love to learn from and with colleagues. So, I mean, this is an opportunity, I guess. I don't know, it's not question for me, I guess. But you can say, if you have something to say. And more questions I'm looking for. Does NI support conference attendance or conference attendance?
So there is I think that there are awards that are specific to conferences. I'm not sure at the top of my head which those are, but also certainly through some of these mechanisms, especially, for example, the D43 award, some of them, depending again on the awards, might have funding that could support somebody for conference attendance. Similarly, a K award, you have those, in addition to the salary support, you have research costs, which can be used, research and training costs, so that can be used to support conference attendance. Tamara, did you have something to add there?
Yeah, the R13, which is a conference grant specific.
Tamara, can you get closer?
Sure, sorry about that. We do have an R13, which is a conference grant, and institutions can apply, PIs can apply for that, and they organize an event and have trainees come or other people in the research community. As far as being able to be supported, if you have a grant, it is an allowable cost if you're attending a conference or presenting at a conference.
Okay, I'm still waiting, questions to drop. And in the meantime, just I would like to really raise one important thing here. And Leo, you mentioned what the main interest of NIMH when it comes to research in what do you call it, LMICs. And I was wondering, just how we can really harmonize, just NIMH's interest with those countries. I mean, are there efforts, in that aspect, just to make, because most of this I can say about most African countries, and their interest is not always aligned with interest of the NIMH. Is there effort in that area? I don't know if Leo can answer that, or Colin, whoever.
Happy to take that, Avera. Can you hear me?
Oh, okay. Can you hear me now?
Yes.
Oh, yeah. We can hear both of you.
Okay, great. No, that is a terrific question, Abera. And it is true that in global health, we as funders need to make sure that our priorities align with the priorities of the countries we want to support and the researchers who live in those countries and work in those countries. The Center for Global Mental Health Research at NIMH has made a conscious effort of aligning its funding priorities with the top priorities of WHO and other major global health players. Like, for example, if you see integration of mental health into healthcare, that has been a WHO effort or objective for the past number of years. If you see suicide prevention, that is part also of the Sustainable Development Goals. So, of course, we don't ask every particular country, but our working hypothesis is that many, for example, African countries, just like the continent you mentioned, are aligned or have worked with WHO to trickle down those priorities, and we are in turn supporting research into those global health and regional priorities.
All right, thank you very much. Maybe Susie, you can remind me when we get to the break. So I have few questions coming in, and one is, can NIMH collaborate with any institution or faculty which has interest to work with them? I think that's yes. Maybe Susie, you can answer, or Neil, go ahead.
Yeah, I'm happy to take that too. We receive applications from institutions throughout the world, low, middle, and high-income countries. They have to be registered, but the registration is fairly simple, and Tamara can help us explain that. But yeah, we receive those applications, and better sport applications get the funding support. So yes, we're happy to collaborate with any sort of institutions as well.
All right, thank you.
He's correct.
Maybe Tamara would answer this one. It is about R13. She mentioned, who is the best contact for R13 conference grant? Who is eligible to apply for it? Also, are they available for low-income countries? All right, coming to you.
Thank you. I'm opening my camera here. So I'm looking at the eligibility here, and foreign institutions are not allowed to apply. However, they can be a subcontract to a domestic institution. So domestic organizations, this FOA is specifically to them. I'm not aware of one that is for foreign at the moment. Okay.
And I see one question here. I hope we have time for that. Do we?
We have about 30 seconds. We could do one more quick one. Yeah.
I don't know if we can do this one in 30 minutes, but let me say, okay, my colleagues in West Africa are interested in establishing a regional mental health network to provide support to clinicians and policymakers. Given that the total number are so small in each respective country, what would be the right mechanism to support? I don't think
Answer to that.
who's taking that?
Yeah, this is a great opportunity, Sharon. Thank you for that question. I hear a sense of the question says, how can universities or institutions in different countries access NIMH funding? There are multiple ways to do that. Of course, one of them is applying directly to funding. Another way, which is something we encourage a lot in our funding opportunities, the 3 requests for applications that Susie mentioned towards the end of her presentation, is we also encourage partnerships between institutions in low and middle income countries and potential institutions in high income countries. That is also a good way to learn from each other and make sure that the research is adaptable to the country, but also that the institutions in low and middle income countries can potentially learn from other partner institutions. So in establishing this regional mental health network, Sharon, you may try to find, for example, call for applications that suits the interest, the thematic interest that you are thinking. So maybe submit an application potentially in partnership institution outside of the countries that you are discussing. Of course, you can do it. You can do the applications without those kind of partnerships as well. But sometimes partnerships can also be beneficial.
Thank you very much. And this concludes our Q&A session, and we'll be back at, maybe on top of the hour, wherever you are. And I really appreciate you for our really panel, for answering those questions. And we'll be out, and the next session is right there. You can see it. Thanks. And bye from my perspective.
And we'll see everyone at 10. Thanks.
Hello, everyone. Welcome back. My name is Mauricio Rangel Gomez, and I will be moderating the second session of this satellite event. And in this second session, it's going to be a bit different than the previous one, and it's going to be bringing perspective from different countries in the world, and it's going to try to understand different models for mental health research capacity building across the globe. And we are super lucky to have amazing presenters today with us. We're going to have Victoria Cavero and Liliana Hidalgo. We're going to have Dr. Walter Manghezi, Dr. Rosemary Musesengwa, and Dr. Annette Son. We're going to be working on 10 to 12 minutes break, and I'm going to have to cut the presenters if they go a bit over the 12 minutes break, the 12 minutes time, to give plenty of time to everyone to provide questions. And I ask everyone, as soon as you have a question, please put it in the chat. Don't wait until the last moment, because we may miss your question if you just wait until the last moment, or you may miss, or you may not remember what is actually what question you had about the first presentation or the second presentation. So please, as soon as you have a question, just put it in the chat, and we will be putting them all together and asking them in the right order when the moment comes. We're going to have quite some time at the end for questions, and I ask the presenters also to ask amongst yourselves if you have questions about the programs of the other presenters. Once I'm going to also add the CVs of the different presenters to the chat, so you can see who's the person, and I'm going to use a lot of time in introducing them, because our presenters are amazing. So it may take half an hour just introducing them. So I'm not going to do that. You will see in the chat all their CVs, and we're going to go here until 10:55, and we're going to have a second break at that moment. So without further ado, we're going to have to change slightly the order of the program here, and we want to ask Drs. Walter and Rosemary to go first, if it's okay with them. We're waiting a little bit on Liliana Hidalgo to join us. So please, Walter and Rosemary, please let me know if you are okay. If not, then we can ask Annette to join us. And Walter and Rosemary, if you can get out of the silence and
yeah,
unmute yourself. Is that okay for you to start us off? And then we will go to
it's all right,
Annette,
yeah.
and then we go last with Victoria and Liliana. Is that okay for all the presenters? Perfect.
That's
so
without
further ado, I leave you with Dr. Walter Manghezi and Rosemary Musesengwa. Thank you so much. And I'm going to stop sharing this so they can share.
Thank you. I'm Rose from Amari, and I'm with Walter, who's also going to join us during the discussion. And what I want to take you through is the Amari African Mental Health Research Initiative. So what kind of model did we use for our mental health research capacity building program that we have? So Amari is running in 6 different African countries. So we are in Addis, in Ethiopia. We are in Zambia, Malawi, Zimbabwe, South Africa, and Ghana. And we also have 2 UK institutions that are part of our program That is LSHTM and King's College. We also had Liverpool School as well, but they dropped out in the second part of Amari. So we have had Amari 1, which was funded by the Wellcome Trust through the Deltas program. And the PI is Professor Dixon Chibanda, who is a well-known mental health specialist. So the overall goal of Amari was to build an African-led mental, neurological, and substance use program that runs and equips young people in Africa to do mental health research. And the number one thing that we wanted to achieve is to establish a sustainable career pipeline for local M&S researchers to integrate M&S research into existing programs such as HIV and AIDS, mental health, One Health. We've also done programs there, and to also ensure that we have long-term sustainability of our program. The model for Amari that we have currently consists of 3 major building blocks. There are so many other things that we do, but they fall under 3 major building blocks. So the first is the academic competencies enhancement series. So what we noticed is that most of our researchers, even after they have been trained, they lack some of the skills for them to compete on a global scale and to continue doing research. So after their training, most of them fall back to just becoming clinicians and not doing any research. So what was developed during Amari 1 via King's College and African institutions was what we call the academic competencies enhancement series. I'll talk about that shortly. And then we also noticed that they also failed to communicate what they are doing for them to become known and also for it to become sustainable within the community that they work. So we have also a huge research engagement and science communication program as part of their training. And also goes without saying, we have the academic program itself, the PhDs, the MSCs. We're also going to have internships and also the BSc students also coming into Amari too. So I'll talk a little bit about the academic competence enhancement series and how it helped the Amari fellows to be able to continue with doing research after their PhDs and after their masters. So ACES, that series, also it actually includes self-development. So we looked at mentoring and training, team working, work-life balance, career strategies, and how they can position themselves to become PIs and senior researchers going forward. We also had the writing skills. What we noticed that a lot of these academics lack writing skills. So they sort of fall short when it comes to publications and taking out their material. So, and also doing grant writing. And then we had the engagement program. So the engagement included things like presentation skills, communication skills, taking your research out on the digital media space, teaching as well, and also engaging policymakers so that your research makes a difference in the community that you are. And the other part that we did was to also run a systems change strategy for each country that we were in. So what we did was to sit down and conduct interviews with diverse stakeholders throughout Africa on how we can make mental health research sustainable and build sustainable career pathways. We have that publication out. You can go and read it. But the main finding was that people sort of struggle to have a proper career pathway in mental health. So they mostly fall into the clinical space and nothing much happens in research. But then what happens a lot in our countries in Africa is that the clinician is also the researcher. So it was up to us to make sure that our clinicians who were also training continue to do research. And the results of that, you can read that off the International Journal of Mental Health Systems. So these are some of the major outcomes. We have 90 plus publications in high impact journals. As you can see, these are just some of our graduates. celebrating, and these are some of the high impact papers that we have. The major outcomes for Amari were the ACES course. We also had a lot of community engagement grants. We sat down with the fellows, we trained them how to apply for engagement grants, how to do engagements on different media platforms. They actually produced a documentary, they produced small clips, they have a YouTube channel, they are on all media spaces. So they got grants to do that. They are also part of a lot of global mental health grants applications currently, and some of them have actually developed to become PIs like Jermaine. We also developed a training of trainers course for the systematic reviews, and this has been running in Ethiopia, Malawi, and Zimbabwe. We also did we also ran a mentorship program. So this was because we had a phased in recruitment. So the first cohort would mentor the second cohort, and the second cohort mentor the third cohort as we went along. Because what we needed was for them to be able to teach each other how to do research and do clinical work at the same time, and how to manage their lives as well. So this mentorship program is still actually running. And we built a lot of networks, developed a lot of networks, and one of them being the Maternal Mental Health Research Network between Zimbabwe, Malawi, and Ethiopia. And they have been making quite a lot of noise and doing a lot of excellent work across all the countries. This is some of the engagement programs across Africa that they've been doing across the sites. Key learning points, we had a phased recruitment. There are pros and cons of doing this. A phased recruitment meant that the last ones in, we struggled with their funding now, because a PhD program will run almost about 4 to 5 years, but we're also coming to the end of our grant and we still needed to recruit. So in the next phase, we are trying to see how we can manage it much better than we did the last time. And there was a very low interest in the postdoctoral pathway. And what we are currently doing is to encourage our PhD graduates to go into the postdoc pathway and to go the academic route, and try and nurture them in that way. But you find a lot of African institutions don't have that postdoc pathway. So it's still something that is developing, and this is one of the outcomes and one of the things that was mentioned when we did the systems change research. And we also struggled to get supervisors. Our supervisors became very much overwhelmed because there are not too many mental health professionals who are actually academics. So there are lots of mental health professionals, but they are not academics, they are not professors, they were not very much interested in doing PhD supervision. So we struggled to do that. So what we then did was to also develop a supervision, strengthening and training program for the supervisors that agreed and those that wanted to be mentored to become PhD supervisors.
Rosemary, sorry to interrupt you. 1 more minute.
Okay. Train your fellows in public engagement and science communication, and do that early at the beginning. And also grant and consortium management that needs to be done and upskilled in a lot of our African countries. So we have a Amari 2 coming up, starting this, it is actually started 31st of March, actually. So Amari 2 is now just started. And what we're looking to do is to enhance some of the work that we're doing in Amari 1, and also incorporate some of the new things that have been happening. Thank you. If you need to contact Amari itself, please write to Biggie. He's also in the comment section. He can put his email, but there is his email, and he will put you in touch with people in those various countries, and with anyone that you want to talk to in Amari. Thanks.
Thank you so much, Rosemary. And we will have a little bit of time for asking questions about this great program. And if you don't mind copying this contact information in the chat would be fantastic. And now we will move to Annette, if you are ready.
Yeah, hi everybody.
Perfect, Annette, thank you so much.
Okay, great. Hi everyone, thanks for the opportunity to speak to you about our HIV training program in the Asia region. And just because I know not everyone here maybe is familiar with what's happening in the HIV world here, we have about 6 million people living with HIV in the Asia Pacific, and only about 2/3 of them are taking antiretrovirals to treat their infection. The picture that you see, I think some of you may see behind me on the Zoom screen, is the view from my office in Bangkok, Thailand, where I'm speaking to you from. But of course, it's nighttime here. So special shout out to all the people in Asia who stayed up late to participate in this session. So I wanted to comment about the mental health care and research gap that Dr. Cubillos mentioned earlier on. This is something that we've been very concerned about in the HIV field way before COVID, but really got exacerbated in the last few years. And that's because HIV itself is a highly stigmatized disease. Communities affected by HIV are often criminalized. And so mental health challenges come up very early in the lifetime of a person living with HIV. And you can see here on the left, this is from the WHO's Mental Health Atlas a few years ago, of the median number of mental health workers per 100,000 population. I think some of you may be overly familiar with this. And you can see on the right, that's WPRs for Western Pacific region, countries like Cambodia, the Philippines, and SEAR is 0, Southeast Asia region, where I am now. And not only do we not have a lot of mental health workers, but we have even fewer who are willing to care for people with HIV because of the stigma associated with the disease. So our pipeline was extremely dry. And this was something we were looking at when we started talking to a network of HIV clinicians and researchers that I helped to direct here through AMFAR's Treat Asia program. What was the most emerging concern that you had? And it was mental health challenges. So what we started doing is some training to try to bring in some experts from within the region, as well as partners at Columbia University, and first to focus on pediatric mental health training. And this was way back in June of 2017. And we had doctors, nurses, social workers, and this really opened our eyes to what was the challenges that people were having, because you don't know unless you ask. And we started asking, and they started telling us, and suicide risk among adolescents was a particular concern. And this was, again, way before COVID. Well, our adult network was quite keen to also be involved. So some months later, in January of 2018, we held a think tank on adult mental health clinical care and research. And one of the people who came in from the Columbia team was Dr. Milton Weinberg, who is there on the right side and actually is one of the PIs for one of the scale-up hubs that Dr. Cubillos mentioned. He's over there on the right in the front row. And when he heard us talk about the pipeline issues we had, he said, you should apply for a D43. And so a lot of us in the room said, what's a D43? And Dr. Pollard has actually mentioned this before. It's an NIH-funded global health training program, research training program, and it really promotes partnerships between mostly universities in the US together with low and middle income countries. They are focused on areas like mental health, infectious disease, HIV. They're 5-year grants, and Fogarty co-funds these programs, these D43s, with other institutes and centers like NIMH. And so this was really Dr. Weinberg's advice to us to grow our own, because otherwise we really weren't going to be able to tap into a workforce that wasn't there. And so what we did was went ahead a few months later and wrote an application, a D43 to the NIH, that was nested in our existing research network called IDEA, which stands for the International Epidemiology Databases to Evaluate AIDS. And actually some of my IDEA colleagues are in the room, in the Zoom room, so nice to see you all. And fortunately for us, we were funded. Our grant was funded by Fogarty and NIMH in 2019, and we're now entering our last year of the 5-year grant. And our program is called Chimera, the name that you saw in the table of in the agenda for today, which If you look really hard, CHIMERA stands for Capacity Development for HIV and Mental Health Research in Asia. CHIMERA is also a 2 or 3-headed monster in Greek and Roman mythology, and actually in Japanese and Chinese mythology as well. And so we looked at HIV and mental health as being these dual epidemics that we wanted to tackle. And we felt we could do this through the science of delivery, also known as implementation science. And we wanted to build capacity within our regions to address HIV-associated mental illness and bridge the gaps that we see in the policy arena and improve the quality of clinical care. So a key feature of our D43 is that it's a regional program. Most D43s are one institution in the US with one institution abroad. We actually work with 4. An institution, the National HIV Program in Cambodia on the top right, you can see just the words, I'll quickly go around. A research institute in the Philippines, the University of Malaya in Malaysia, and a special institute for HIV research and innovation in Thailand, which is actually the place where you saw earlier that Drs. Gordon, Kubios, and Rausch visited in Thailand some months ago. And we partnered together with Columbia. Dr. Weinberg is my PI, my co-PI for this D43. And so these are the mentors within these 4 countries who really make sure that this work happens. It's not Dr. Weinberg that makes it all happen. It's not me. It's really a collaboration with the regional mentors. And on the left, you see our mentor, Dr. Vichai in Cambodia. He happens to be the director of the National HIV Program for the country, which allows us to tap into the potential for policy impact. On the bottom is Drs. Rosana Dutango and Dr. Isabel Melgar. Dr. Melgar is a psychologist in the Philippines, and they are linked to the Department of Health, which again is another way for us to tap into what's happening in national guidelines. On the right top, Dr. Reena Rajasuriyar is at the University of Malaya, where they have another D43 on HIV and implementation science, not mental health, but they still are able to share faculty with us and help us to think through some common challenges. And the bottom is Dr. Nitya Panupak in Thailand at the Institute. She was actually in the photo on the left wearing a mask that was shown of the visit in Thailand. And her program has a key population-led health service model that has been a teaching platform for all of us here in the region and others outside. And they also have a transgender clinic network that we felt could be a great platform for our fellows to learn from. So we enrolled 2 classes of 8 fellows each, and they're in 3-year cycles. And the photos on the right, the one at the top is in Thailand, the one at the bottom is at Columbia last year, where we were able to go after travel restrictions were lifted. And our fellows get trained in HIV, mental health, implementation science, research methods. They get faculty from within the region as well as globally, and all 16 of them are doing pilot studies on how to integrate mental health care into HIV care, routine HIV care. They've also gotten mentorship for career development, and they're directly engaging in the IDEA platform or the IDEA network so that they can do even more research after their training activity is finished. So internally, we've tried to grow even as the program has just started. We did modification of our training curriculum. We encouraged the first class to mentor the second class, and that's kind of reflected in the photo on the right, which is our site visit to our team in Manila, where the class 1 fellows were both medical doctors. The class 2 fellows are a PhD student and a social worker. They all bring something different to the table, and they are able to mentor each other. And we collaborate with regional D43 programs in Malaysia, as I mentioned, but also another one in Vietnam, which is on implementation science. So these are a few highlights of our trainees and the impact they've had. We have 16 trainees, and in the last few years, they've had 19 abstracts presented or submitted. They've been invited to speak at conferences like AIDS 2022. One of our fellows gave a plenary there. That's a photo on the top right. Other fellows spoke at their national HIV meetings, including the fellow in the bottom there, right, in the Philippines. We do not offer degrees. All of our training is done while people are in their full-time jobs in their institutions, which helps to avoid potential brain drain. But a number of them are doing their own degree programs. Some of them have been promoted, I think, as a result of kind of building their career potential through the program. At least I like to think so. They've been engaged in our IDEA research, and there's really been some policy impact where we've seen beginning to see more and more integration of mental health screening for anxiety, depression into the national HIV programs in Cambodia as well as in Thailand. And so this is my last slide where I bring up my objective, the third objective of our D43, which is to build gaps between HIV and mental health in order to guide policy and improve clinical care. And the way we sort of think about this is this image of bamboo. So this is a metaphor that I started talking about from the very beginning of our training activities almost 5 years ago now. And bamboo is a plant which takes about 3 years to really get the roots into the ground. And then after 3 years, sort of shoots start to emerge for kind of the next bunch of bamboo. And we're kind of here between our first class, our 3-year class, which was sort of extended because of COVID, and our second 3-year class. And then in 5 to 7 years, bamboo is mature enough to be harvested. And so for us, we think we have the potential to see more and more of these seeds being planted, and this attempt to integrate mental health care and research into HIV care and research, resulting in successful expansion of the pipeline that I mentioned in the very beginning. And so, of course, I have to acknowledge the many people who have worked with Dr. Weinberg, my co-PI. Honestly, this would not have happened without him. The team, Jeremy Ross at Treat Asia, Claude Mellons at the Department of Psychology, also at Columbia, and all the mentors and our operations team and our support at the NIH, Geeta Bansal at Fogarty and Pim Browers and Susanna Allison at NIMH. And I'm happy to answer questions in the chat and then during the discussion. And thanks again for the chance to be here.
Thank you so much, Annette. Amazing presentation. We have had an amazing 2 presentations so far, and closing us up, last but not least, we are going to have Victoria and Liliana. So are you ready, Victoria and Liliana, for taking over?
Yes.
Perfect. Thank you so much. So the mic is yours.
Thank you. Let me share my screen. Okay. Thank you very much for the opportunity and for having us here. We would like to share the experience of Crónicas, the Center of Excellence in Chronic Diseases. So, Crónicas is a research center based at the Universidad Peruana Cayetano Heredia. It was founded in 2009, and initially we received funding from NIH. Our institution has been internationally recognized, which is something that we're very proud of, as well as we're proud of having an interdisciplinary team that has carried out various research projects on chronic diseases, including mental health as well. And we have conducted clinical trials, pilot studies, implementation research, etc. And we have more than 500 scientific publications. So what is our capacity building and component at Crónicas? Well, actually, we don't have a capacity building component as solid as the ones that have been presented early in these presentations, but perhaps this has something to do with the fact that we don't have specific funding for capacity building activities. However, we do know that this is an important component, and we have implemented some activities that could help on these. So we have split our activities into formal, informal activities, and the environment. So first of all, regarding the formal activities, we have a Crónicas Scholarship, which is an annual scholarship for a master in epidemiology at our institution at the Universidad Peruana Cayetano Heredia. And usually this scholarship is provided to a student that has a focus on chronic diseases. The idea is that the person who takes on the scholarship will also collaborate with the projects at Crónicas that we are conducting at the moment. We also have an internship program that has been a little bit unstable. We had a couple of interns around 5 or 6 years ago, but now we are starting this again, and we know that it is important since at least in our country, it is not usual to think about research as a career line, and we want to make people aware that this is an opportunity that people can grow in this field. So that's why we believe that promoting internships is helpful so that people can start working in research early on. We also have a welcome package to everyone who joins Crónicas, either as an intern or either as a research assistant. The idea of this welcome package is to know or to be aware about the values we share at Crónicas, and also to have an ethical training that is the minimum for all the projects, and then each project will also continue with more ethical training. And lastly, we also have funding for short research courses. And the idea is that the people who take on these courses will then share the knowledge with the other parties at the institution. In regards to the informal activities, we have an activity called Crónicas Conversa, or Crónicas Talks, in which each month a member of our institution shares what they are doing in their projects, and they ask about some things that are difficult to manage, or perhaps they share the results on their studies, and then everyone can discuss about them, and we promote critical thinking during these activities. Also, we have Mental Health Fridays, which is a weekly activity in which we try to share some topics that are important to us in regarding to the projects we are conducting. So the idea is that everyone will share something they found interesting in the literature, and then we can discuss about this as well. Finally, and I think this is a very important element, is the environment at our institution. We have an environment that promotes multitasking and therefore multi-learning, because we try that everyone has the opportunity to learn new things. For instance, and I will take the example of I will take me as an example. When I first started at Crónicas, I didn't have much experience in research. I remember I had like 5 months working at another institution in research, but that was all. And thanks to Crónicas, I think I had the opportunity to learn about collecting data at the beginning, but then I was given more responsibilities, such as protocol writing, grant writing, paper writing, understanding how to manage risk, how to manage ethical procedures. And then in the latest years, we have also started to engage with policymakers. And this is something that I believe shows how our institution trusts us, and helped us learn more about the different research activities or about everything that research entails. And finally, regarding the environment, I think we have a nurturing setting as well, so people can have the liberty to go abroad and study their masters or their PhDs, and then there's always a welcoming environment that will take you back to continue with progressing on your career at Crónicas. I will now pass on to Victoria.
Yes. Hello, everyone. I don't know if you can hear me.
We can
Yes.
hear you, Victoria.
Okay, perfect. Thank you. Okay, so Liliana has explained about our activities and what we do we do in Crónicas. Now I'm going to tell you about the achievements. Some of these activities, since they are informal, they don't have like an actual outcome, but some of them they do. So for example, Crónicas in these 10 years or more, they have provided 22 scholarships to different students. And so far they have been more in this master that Liliana explained in epidemiology, but now they are trying to move on to another fields. So for example, in policy or in engagement, capacity building, no? Because the idea is to contribute to the center projects and research. So the idea is that this scholarship also goes in that line. We also have had 6 interns in this period. Like we currently have, I think, 3 interns. In the past, we have had like 3 other ones. The Crónicas Conversa, it has more than 8 years of continuation, even though it is not like a formal activity per se, but we have like this continuation in which someone comes to the office and explains and talks about, no? Or we ourselves gather together. So we have more than 8 years doing so. We also have, and this is like a Crónicas as a whole group, like they research in terms of different chronic diseases, not only mental health, but we also have these Mental Health Fridays, which is only specifically to mental health, and it's focused on coming like the people around mental health projects. We gather together and we talk about a paper that we found that it was important, or we share our own activities to learn from each other, because different projects have different methods and different populations and different activities. And the idea is to share with everybody so we all can learn and we can all contribute to these experiences, no? Even especially when we have like some challenges and difficulties. So we have more than 2 years doing this. And we also have had more than 10 people that have left to study abroad, for example, especially to Europe, to the UK, to Switzerland, or to different countries to study their MSc or their PhD. Even Liliana and I are 2 examples of this. And then we have returned to work or currently collaborate with Crónicas, no? Because this is like a positive environment in which we feel always welcome to come back.
Victoria, 1 more minute, please.
Okay, thank you. Liliana, can you move? Yeah. So some specific challenges and difficulties are the lack of specific funding for CV activities, for capacity building activities, a scarce time for mentorship, because all of us are involved in these activities of research, not in capacity building, so we have a scarce time for that. And the small projects do not allow long-term initiatives for capacity building activities, no? So it's like every project focused on their own capacity building activities, but specifically. And finally, some recommendations that we can give is engage various projects capacity building components into a larger and common set of activities for all the team. Propose realistic and precise short and long-term community building plans, including aims, roles, activities, timeline finding, to have something more structured. And finally, do not limit capacity building to specific activities. No? Our most important learning is that you can build capacity within your team by training them for various research tasks already part of your practice. No? So we both have learned a lot in doing research in the way, like going on. So it's very important to give the opportunity to others to learn as well. So this is our presentation. Thank you very much. And I don't know if you have any questions.
Thank you so much, Victoria. Now I want to ask all the presenters to come on camera, and so we are ready for the question and answers part of this. So I don't know if I will be able to see you all. I see Annette, I see Walter. There are like 5 screens, so I don't see Victoria or Liliana, but maybe you are in a different screen for me. But so I will try to pin you at some point, but I want to start by a question that was posted. Some of the questions are quite specific, but one question that was posted here, which is related to what are the lessons that you in your specific projects in specific countries have learned in terms of building capacity in mental health services? as opposed to research capacity in low and middle income countries using lay counselors or supervisors. An example is task shifting or task sharing approaches. I don't know if you have used that. If you haven't, then it's okay. But if you have used that, or if you have experience with that, what are the lessons that you have learned from that experience? And anyone can start. Just don't feel free to just unmute and start answering.
Hi, Mauricio, this is Annette. I'm happy to start. A lot of emerging use of technology. I mean, one is task shifting to people who are not so-called mental health professionals, but maybe mental health counselors, maybe community lay providers. And I just put a link in the chat to a paper that Dr. Weinberg wrote, actually out of a D43 training program in Mozambique. That may be one example. Another way to do it is, of course, through telehealth, which we now have a lot of experience with through COVID. And one of our D43 fellows is doing work on telebehavioral health, which I think if you live in the US, you hear commercials about this every 10 minutes, but it's not really something that we have so much of here within the Asia region. And so I do think that those are going to be ways to create greater access to more mental health care providers at whatever level they may be.
Thank you so much, Annette. Any other ideas from other speakers?
Maybe I could just share a bit of our PI, who's Professor Chibanda. He's got the friendship bench that basically is founded on that, on trying to align to what is the traditional structures already, and then optimizing that and give them capacity to deal with mental health projects. So he's worked with grandmothers, were a key factor in our extended family structure. Thank you.
Perfect, Walter. Thank you so much. So if no other speaker wants to answer this one, so I will go a little bit more specific into some of the questions. Some of the questions are related to the first program that we talked about, and has to do, and I think that some of those questions were already answered by you, Rosemary, at some point in terms of how to join the MARI program, especially for people from different countries within Africa. And I guess we will be sending, that's something that I wanted to tell, we will be sending to the presenters some of these questions for you to feel free to start interacting with the participants to the conference as well, because there are some of the questions that are quite specific. There is a question from an NIMHer, and it's can someone please comment on the idea of building research capacity in basic and translational mental health research, in addition to the types of efforts described today? Is that clear for everyone? So I'm gonna repeat the question. Can someone please comment on the idea of building research capacity in basic and translational mental health research, in addition to the types of efforts described today? So how else we can continue building on these ideas? And I think that Crónicas had a really great set of experiences, and same as Amari. So if you can think about how to build this kind of efforts, and what tools, what type of components we should really start considering very strongly, more than open to start the conversation there.
Now, maybe I can start off and say, for our MARI program, the second objective really was to integrate mental health research into other programs, because mental health is sort of cross-cutting. There's mental health and HIV, mental health and maternal programs, mental health and young people. So what we then did was to try and have professionals, not only mental health professionals, but also professionals from other health professionals like nurses, physiotherapists, occupational therapists, who are also looking at programs that have to do with mental health. So the bulk of our students actually are not necessarily mental health professionals per se, to say psychologists and psychiatrists, but they come from the other disciplines. So to integrate the mental health training programs into other programs would be the best. And for the question that you asked about how can you join Amari, so the other way to do it is we have programs that are currently now running in Zimbabwe. One is under Walter, the other one, so Walter is right here. You can get in touch with him. They have a PhD program running at the University of Zimbabwe and the other universities. So that's the fastest way, is to get enrolled into one of those PhD programs that is being run by Amari. At country level, it would be to get in touch with the PIs and say, this is what we have, and this is what I want to do, but I do not have funding. And they can see how they can integrate that into Amari too, because what we are looking at is integration and having mental health studied at by different professionals, not just psychiatrists, because we don't have enough mental health professionals anyway. And most of them are clinicians. As you can see, Walter is actually sitting in the clinic. So he's coming on and off. He's just left patients and come to the presentation. So the best is to also get other people who are working within mental health, but not necessarily mental health professionals. I think that's a good model. I think Victoria touched on it, or was it Lillian as well? Yeah.
Thank you so much, Rosemary.
I would like to add something. So I agree with everything Rosemary mentioned. And I think that something additional to that, and that we haven't discussed yet, is it's including people with lived experience of mental health problems in the research group. So I don't know the situation in other countries. I can only speak about Peru, which is a low and middle income country, and research is not something that is well funded. So if it is already difficult for researchers, I believe that including people with experience of mental health problems is even more difficult, because sometimes there is no funding, sometimes there is no expertise on how to work with them. So this is something we are trying to incorporate in our projects, to have lived experience advisors panels. And I believe that this is a key element on all the research we conduct in mental health.
Thank you so much. Walter, you were going to say something.
Yes, okay, I was just going to add another angle. I think for us to sustain the work we're doing, we really need to ask ourselves, how do we capacitate those who are going to train the future leaders? So a lot of the work, like I'll give you an example, our Zimbabwe experience, all this work started off with an NIH grant that was targeted at trying to build up a critical number of psychiatrists, because we were quite short of psychiatrists. That was between 2010 and 2015. It was called the IMES grant. There was a sub-award of our NECTAR grant. So in doing that, we had a critical number of people who could lead, and that brought on the Amari grant, which we then said, no, let's use a multi-team approach, look at the mental health team, and get all cadres from all walks, so that we then build up. We did a lot of TOTs, soft skills, like the ACES program, how to teach, how to write briefs for governance, and all those things, so that we are able to sustain it, so that after the fund's gone, we have a critical number of people who can continue doing that work and continue teaching others and building up capacity. Thank you.
Thank you so much, Walter. Anyone else? I want to acknowledge Keith Martin. Keith, I'm assuming you are part of the CUGH executive committee. So if we left the the chat on for everyone on purpose, so you can go and check into the different comments from everyone and look into the resources that Keith has been suggesting for everyone. So please go back if you're interested and see there is an open access tool that Keith has suggested. It's called CUGH capacitybuilding.org, which is a really nice. I have seen it myself, and so I'm gonna try to summarize some of Keith's. Keith, you are the executive director of CUGH, so welcome again, Keith. So I'm going to try to summarize the questions that Keith has posted across the chat, and that may be relevant to hear from our speakers. And it's in terms of having in mind, and I think that some of you already touched upon that a little bit, and it has to do with the lack of resources all across. And the high incidence of mental health disorders, and the high incidence of mental health disorders in connection to other type of diseases like HIV in your case, Annette. So how do you navigate the capacity? How do you navigate capacity building in those contexts of low resources in each one of your countries? And that connects to something that Annette started replying to this question in the chat, is how you do advocacy and policy work in the governments. So I think all those questions come into how do you navigate an environment of low resources, and not only low resources financially, but also in terms of mental health providers and mental health professionals. And also, how do you navigate advocacy in terms of your local governments? And I would be very much interested to hear from each one of your experiences in Africa, in Asia, and in Latin America. And you can start any kind of start, and I will try to see which one is wanting to go next, so we don't talk over each other.
I can begin if you want.
Perfect, thank you.
Okay. Our experience in Peru has been working with policymakers at the local level. They're called directions of health, that they manage the health centers in primary care. And we have also worked more directly with the health directorate, the mental health directorate at the Ministry of Health. So this has been like a long road. We have been working with them for several years in some projects, trying to involve them. For example, one was funded by the PAHO. So they were like co-PIs in this study, in this project. And it was focused on something that they wanted to improve in the community mental health centers, which are new in our country. And then we have helped them in some initiatives that they want to conduct, support them in writing a grant for some activities, and they have helped us with other initiatives in doing some projects. So we try to get close with them, and we are currently helping them with some initiative that they have in the electronic health records here in Peru. So we try to align our projects to the government initiatives. And an important point that I think is a facilitator, I guess, is that the Mental Health Directorate has been the same for several years. No? The key persons working at this direction have been the same. So we have this continuity of work. We haven't had the necessity to engage with someone and then the next month to another one and then to another one. So for several years, they have been the same people. So this have helped a lot in the initiatives. And because we are kind of aligned, because they see that research is important, but yes, they don't have the resources to conduct them. So it's like a win-win activity in some aspects. No? The challenge is to engage, to communicate, because our priorities can be very different from them. So we have to learn how to communicate, how to interpret the topics, because we say one thing and they understand another, and vice versa. So it's important to engage in that way as well. But I think the good thing is to keep a constant work with them.
Thank you so much. Who wants to continue? Annette, Walter, we have only 2-3 minutes, so I wanted to be super short. And I want to tell you all these questions, we will be conveying them, all the ones that are coming into the chat, we will be conveying them to the speakers, and we will try to find a way of replying to you. So if we haven't answered your question, just please add your email to the chat, and we will certainly be sure to reply to your questions. So I will just call Annette. Do you have some ideas about that, and then I will ask Walter the closing question.
Sure. About trying to move policymakers, absolutely agree. This is critical. I think the link I put in the chat box about the Philippines, they had to pass a mental health act mandating the government to create resources for mental health providers. That was in 2018. They just now passed how the government can do that. I think it's a really good story of how they did this, and certainly it was delayed because of COVID. The other thing is the Global Fund. So the Global Fund became more willing to allow countries to include funding for mental health screening and services, but the country needed to advocate for it. So making sure that you have community mobilizers and advocates on these advisory groups can really make a difference when it comes to external funders. Thank you.
Thank you so much, Annette. Walter or Rosemary?
Our experience is very similar to what Victoria said. We tend to ensure that we have some sort of stakeholder meeting where we do bring people in authority on board before a research, during the research, and at the end of the research. We also try and incorporate aspects of implementation science, where we try and bring research to the clinical setting. That also helps us to be seen to be doing things useful because often people in government want to see results. So you also want to demonstrate that you're making a change and you demonstrate impact in whatever you do, and whatever results we get, we disseminate to them, especially if we can demonstrate impact. Thank you.
Thank you so much, Walter, and thank you, everyone. These questions are inspiring. The lectures are definitely amazing, and thank you so much for accepting our invitation. Now we're gonna transition into a short break that is gonna take us until 11 a.m. Well, 11:01 is a 5 minutes break, and we're gonna come back to our third and final hour of the event. Thank you so much, everyone.
All right, hello everyone. I would like to start our third part of the morning here. This will be another panel session, and this is entitled Challenges and Opportunities for Developing a Career in Mental Health Research. We've had a great set of discussions so far, and we have 3 more expert practitioners in the field who will each make presentations of about 10 to 12 minutes. And during that time, we encourage people to put any questions in the chat, and then we will get to the questions at the end in the last 25 or 20 minutes or so. And I've really been excited and kind of inspired by the earlier presentations and very active discussions so far. So our presenters for this second panel session are Dr. Harth Ola, Dr. Lola Kola, and Dr. Evan White. And I look forward to hearing what they have to say and the discussion afterwards. So we'll jump right into it then. So
thanks, Dr. Paul. Yeah. Let me share my screen. Yeah, 1 second. Is my screen up now?
Yes, that looks great. Thanks.
Okay. So yeah, thanks, Dr. Paul. So I'm here to talk about career in mental health research. I would probably give you more of my own personal experiences. I am assistant professor of psychiatry at the integrative medicine department at NIMH. So you can see here on the map, I'm in the south part of India. So let me begin with my own career, what challenges and opportunities presented as I started out as a mental health researcher. So I have a medical background. So I did MBBS degree, which is basically something equivalent to MD in the US, wherein you have a basic a medical graduation, and following which you do a postgraduate residency, which is what we call here in India as MD in psychiatry. So, so unlike in the US, wherein MD is also equivalent to MBBS here. So after, I did my MD in psychiatry, I chose to do a clinical fellowship, a postdoctoral clinical fellowship in addiction psychiatry. And I think this is the period which is, I believe, is my formative period, wherein I started learning about, the whole host of challenges that comes with addiction. Even with judicial use of pharmacological intervention, psychosocial intervention, addictions do run a chronic relapsing, kind of a course, and you kind of have a revolving door. So you would need to have more innovative, more, effective intervention, so to speak. And this is also the time where I realized that addiction actually starts much earlier in life. So I started to explore. I wanted to actually do more intense study of what goes on before the addiction actually starts. So I decided to take an unusual route, because I wanted to do a PhD after I did my postdoctoral fellowship. So I enrolled into a PhD program. It is not a funded in institutional PhD program, but it is an extramural kind of a PhD program, which this is a time wherein, we don't really have funding for PhD, but then there was a research training fellowship that came through, which was actually started in collaboration by Wellcome Trust UK and DBT India. So they came up with a research training fellowship, which is first of its kind fellowship program for people who have just graduated from their post-graduation, and that is the MD programs. So I got a protected time to develop research skills during this period. And before I could complete my PhD, I also got an opportunity to be a clinician scientist in a much larger program, which looked at wherein I was managing a cohort of multiple people with addiction, their families, their children. I also would do deep phenotyping, imaging, and also look at genomics. So this gave me a lot more exposure to research methods. And before I could even finish my PhD, I got a regular faculty position at NIMH. So I would say I'm a rather outlier, or except, this is not the usual path people take in India. I say this because I'll explain in the next slide. So what are the broad challenges to build a career mental health research in India? So the 2022 data from Indian Psychiatric Society says that there are about 10,000 psychiatrists currently in India. So for the population that we have, about 1.4 billion, the ratio would be around 1:137,000 people. So which is much less what the WHO would recommend mental health professionals to be at least 1 in 10,000, one psychiatrist or mental health professional for every 10,000 population. When you look at high income countries like Australia, the Northern Europe, the North America, Europe, you have more than one psychiatrist. You have 6 to the 4 psychiatrists per 10,000 population. And we learn from them that even this number is actually not sufficient, let alone Africa, Oceania, even Latin America. The number of psychiatrists per 10,000 is very, very less. So at right now, we produce about 10,000 psychiatrists every year from various medical universities in India. So going at this rate, it would take us nearly 50 years to reach 1 in 10,000. I'm sure that we have already learned that even this number is not really sufficient. So what this has led is, we conducted the first national mental health survey in 2015. NIMH was the key institute who did this. And we, not surprisingly, we found that treatment gap for mental health conditions in India is currently at 83%. So only about 17 people get treated. Let alone for things like alcohol, drug use disorder, the treatment gap is as high as 95%. Even for common mental illnesses like anxiety and depression, the treatment gap is 70+. So what are the causes? So I mean, we know that the mental health professionals are at an acute shortage in India, but also another problem is the unequal divide, the rural and the urban divide. So more mental health professionals are concentrated in the urban areas, and we also have very poor primary care integration. Not only that, we also have a lot of stigma associated with mental health conditions. So people do not seek help. And there is also lack of awareness because people with depression don't often seek out help. And I mean, the financial barrier part is probably the most important because most mental health expenditure is currently out of pocket in India. So most insurance companies don't really cover mental health treatment. So you would imagine, so a person getting protected time for research is actually a luxury in India, so which is not the usual route. So what have we been doing at NIMH? So we wanted to take a step back. We have only about 1 or 2% of the entire medical graduates taking up psychiatry. So we have around 80,000 medical graduates, every year who come out, who graduate, but only about 1,000 take up psychiatry as their profession. So we wanted to explore a slightly different approach. So in 2006, NIMH started a PhD in clinical neuroscience. I mean, across psychiatry, neurosurgery, neurology. I mean, this is open to any kind of neuroscience research. I mean, this was an initial big hit in the initial 3-4 years, but then we realized after people who finished their PhDs, when they actually went out and looked for a job, I mean, there were very limited job opportunities. That was because most medical colleges in India require, if you have to be a faculty, they require you to have an MD degree, that is your postgraduate training, plus 1 or 3 years of post MD experiences. So you would find it very difficult for these individuals who have a niche PhD in clinical neuroscience to find actually a faculty position anywhere in India. And there are also very limited, if they wanted to continue in their research trajectories, there are very few career development grants currently available in India. So what this led to is a brain drain. I mean, nearly 1/3 of the people who finished their PhD in clinical neuroscience left India for better opportunities, and most of them actually haven't returned back even after the postdocs. I mean, those who remained in India, very few actually remained in academia, and some, in fact, they after they actually finished their PhD, they went back and they did their post graduation so they could get into faculty positions. So this actually did not work out that well. So in 2017, we thought we'll have, okay, people need MD, so let us introduce PhD course post MD. So they have the post graduation, and then we can open up the PhD course. These are institute funded ICMR fellowships. But in the last few years, we have been seeing that there are very few takers for this kind of a course. And in fact, in the last year, we had only 1 or 2 people who took up this particular course. That is because, I mean, they're already post MD and they will have to invest more years in research. I mean, as you know, we don't really have the luxury of a lot of mental health professionals in India. I think the next thing that we are thinking of is to have an integrated MD PhD course wherein you finish your MD as well as PhD within 5 years, but you have both MD degree as well as a PhD. That may be something we'll need to explore in the future. So let me frame it back in this SWOT approach. So what are the strengths, what are the weaknesses, opportunities and threats for developing a research career in mental health in India? So if there are strengths, especially we have few really well-established institutions who can deliver quality education, and we are actually increasing the mental health training in the last few years. There are a lot of government-funded programs that have come up in the last few years. So those are our strengths. And of course, as I said, there are actually acute shortage of mental health professionals in India. So the people taking up research is far less. And there are also the urban-rural divide. There are very few services in the rural settings. And as I want to stress on this particular point, there are very limited career development grants or mentored research grants. Most of the grants are at the level of much advanced stage in your career wherein you are managing a much larger grant, but you need to have a more number of grants actually in the early part of your career. Post-COVID, we have realized a lot of people are actually aware of mental health challenges. So there is increased awareness, and even there is a lot more funding now. Even the private sector is pitching in with a lot of funds, and we have also seen a lot of international collaborations are happening in the last few years. So those are really the opportunities to increase the mental health research capacity. Most importantly, there is stigma.
Sorry, Dr. Brett, just one minute left, just so you know.
Yes, yeah, this is the last slide. So most importantly, I mean, there is a lot of stigma associated with mental health, not only for people receiving treatment who are in need of treatment, but also for professionals. And I talked about brain drain, and also there is a lot of professional burnout. So we wear multiple hats. Most people clock more than 80 hours in a week. Psychiatrists, being a academician, administrator, clinician, and as well as a researcher. So there are a few newer opportunities that are coming up in India. There are some of them are primary care mental health initiatives. Some of them are actually digital mental health initiatives to democratize. I mean, we are running a lot of free mental health training courses, and people all over India are taking up from lay counselors to physicians to pediatricians to multiple across the spectrum are taking up these kind of courses. I mean, most big mental basic science translational research happen when there are big funding for life course studies in mental health, and we have been fortunate to have a few landmark studies which happened in the last few years. These are some examples. I will post the links on the chat box. You can look up more on these. We also actually have a new wave of private Indian funders, philanthropies who actually are funding mental health research in India. So these are a couple of examples. So with that, I would like to conclude. These are some of my collaborators and funders who have been very supportive. Dr. Paul is there from the AFNI group, and most of what we have learned in India is through a lot of these training workshops which happened with a lot of these CVEDA and the IDBS programs. Thank you.
Great. Thank you very much, Dr. Bharat, for that personal, institutional, and nationwide overview. You really covered a lot of topics there. Next speaker is Dr. Lola Kola. You could please share your screen.
Okay.
Okay.
Can you all
great.
see my screen now?
Yes, we can. Please
Very
go ahead.
good. Yeah. Thank you for inviting me to participate in this workshop. It's a delight to be part of this group. My name is Lola. I am affiliated to the WHO Collaborating Center, Department of Psychiatry, University of Ibadan. I'm an associate professor at the Lead City University in Ibadan. Talking about challenges and opportunities for developing a career in mental health research, I will be using my own perspective, just like the other speaker, but I'm just going to take a different approach to it, speaking basically just from my own experiences. A very pertinent question to start in is asking the question that how do we take up available opportunities? I believe that preparation is crucial to being able to even take up opportunities, because without preparing, then there's actually no basis, or there's no base for being able to take up opportunities. Now, the number of opportunities afforded by funding bodies to early career researchers aiming to develop a career in global mental health, but I will use the NIH example because I've benefited tremendously from this. I'll be talking from my experience of my K43. I'm in the 5th year of my K. I'll be starting the 5th year of my K in about a month's time now. The NIH K43 grant positioned me for an independent career in global mental health. I had quite some significant experience before applying for my K, but my K43 has been very instrumental in actually stabilizing me as a researcher. So briefly, what is this award for those that don't know it? It provides protected time of at least 75% to successful awardees from low and middle income countries who are junior faculty members and who aim at having an independent career. And those people would have been persons that haven't held any independent position in terms of leading their own large research. Such persons have to be based in LMIC, like I've said earlier, and there will be need for such persons to have a primary mentor in low and middle income country, and then a US mentor. So another thing to, even though this award, I mean, quite a number of people are getting more aware of it. People found it daunting, but I've had the privilege of speaking to quite a number of people concerning it. And I would say that, yes, it could be daunting, even from my own experience. But it was my second K that was successful, but I certainly think that it was doable. I had very good support from my US mentor, and that has been very, that has just been one core thing in my career. Yes, so it is very doable. So now speaking from my experience, my research experience. So this is my background research experience in terms of preparation. I have a PhD in medical sociology. So my expertise is actually in the area of epidemiological studies and qualitative research. And then, so I got funding for my PhD from Columbia University Mental Health Scholarship Program. As a senior researcher at WHO Collaborating Center, Department of Psychiatry, I had tremendous years of experience in epidemiological research, substantial experience in psychosocial intervention, developing for patients with mental health conditions in primary care, in terms of fully powered clinical trial implementation studies. I'd actually coordinated quite a number of large studies. I've been privileged to be part of a team that has been successful in terms of grant writing. And so I came with all this background, and then I had this background of work with the WHO. I took 3 years to work with the WHO country office in Nigeria. So I had some policy experience with policy too. So those were the background of my work, the preparatory things I had in preparation for. I wasn't preparing for my K, but I was preparing for an independent career. So a K announcement came, and I was able to fit in. So all this nicely doved into my request for more training opportunities, and for my K, which was my interest is basically in digital mental health, and so I wanted to know more about it. So my training opportunities, my training aim for my K is methods in mental health implementation studies. I wanted more experience in that area, and then advanced analytic statistical method, and of course to be able to develop to develop myself professionally and my network in terms of being able to lead large clinical trials. So now I've had my K is supposed to lead me to an independent research career. I've been able to apply for an R1. I've had my first attempt, and it didn't succeed, even though we got, it was discussed. It didn't succeed. We're not discouraged. And so I'm working on the second application. So in terms of barrier and facilitators, so my experience too, so one of the main barriers is limited mentor in low and middle income countries. And I say low and middle income countries because I'm not speaking just for Nigeria. I've been privileged to work with very senior researchers, but I see my colleagues struggling with this. And then having full-time appointments. We don't have, many of the countries in LMICs, we don't have the privilege of scholarships, and to be like, when I was doing my PhD, even though I got funding for it, but I was still holding a full-time job. So it was like having doing a full-time PhD and doing a full-time job. So all these kind of things were there. Those are main barriers. And then the fear of failure. those are things that that was a main point, a main difficulty for me that I had to overcome. I actually stayed too long before reaching out to try work on my own because of fear of failure. But that doesn't have to be. That was just some personal issues I had to sort out. So in terms of facilitators for me, hard work was something that I was very used to, having worked with very senior people, having interactions with funding bodies. So all those things were things that came naturally to me. And then, but one of the main things during my career was a U19 project that happened in sub-Saharan Africa. I was the hub administrator, and this exposed me. I had very tremendous experiences being exposed to reporting and interaction with the NIMH staff. And actually, that was one of the main causes that actually built my confidence. And I had a lot of informal mentorship from the NIMH team members. So, and then I had the determination to succeed. And actually, that was after overcoming fear for failure. So my K is actually on digital intervention in a perinatal population. I developed a mobile phone application as adjunctive treatment to face-to-face care for this population to increase their access to care. So, but one of the things I want to add is that since my K, I was able to get additional funding, to be able to test the video, which is part of my app. I was able to test it in a group setting. I mean, and that came out of because I had my K, so I could build another story. This was small grant, but it was able to make me even explore further. And then after that, I've been able to get an additional funding in terms of supplement from FIC, from the Fogarty, and that has been actually good to. So for that, I'm studying, I'm developing a health education intervention for mental health and climate change to address mental health and climate change problem in young mothers. That is very well on the way too. Now, so these are some of the opportunities that the K provided me. So this is just to just show us some of the work I've done on my app development. So we use this user-centered approach, co-production using implementation science principles of involving users that will be central, users are central to the production of what we are doing. And I've used using the agile development process in iterative prototype development to be able to actually develop something that is age and culturally appropriate for young mothers. And field testing is showing very good and promising results in this population. So the last, this side is on the right, which will be your left, is actually some of the screenshots of our videos, which are really very impressive and very colorful because the mothers like colors. And then, so those are some of the things that I've been able to do with my K award. Now, things to consider in terms of early career researchers in our midst that are trying to get their first funding. So I will say that preparation is key. Like I said, planning. And the planning, I mean, I get people that come to meet me and they want to apply for a K in 2 months. And I try not to discourage people, but I try to tell them that planning is very crucial. If you don't plan, you're going to fail. So I will say, I mean, not standard, not gold standard, but give yourself like 5 to 6 months and to be able to, because you have to get mentors and then they have to help you. You have to work with your mentors on your ideas. So preparing proposals for a funding announcement, even before it's available, is very crucial. And officials of the funding body, I found that they are very important. Talking with NIH officials actually helped me a lot. And previous grant awardee, sometimes I tell myself it's like I'm a contractor now for the three, because so many people keep coming across to me. And I'm very happy to share my proposal and share my ideas with people, because I got that from others too when I was preparing for my grant. And then one of the things I learned very hard lesson was to read instructions. The NIH on its own, they have very bulky instruction manuals. So I actually wasn't going, the first time I think if I would have saved myself some time and some effort if I'd read it, but I didn't in the first time. So but by the second time around, I was able to sit down with it. And then lastly, I would say it's very important to persevere. So protected time, what have I been able to achieve? Since 2019, when I got my award, I've had additional 25 publications and I'm first author on 12. And I will tell you, before my K, I had just first 4 authored publication. And 12 of this publication has been in Lancet Psychiatry and Nature. And I tell you, for even those big journals, they invited me. It wasn't like I submitted to them. They were the ones that invited me to submit. So there was some kind of fast track in the process.
Lola, just to let you know, sorry, just 1 minute left, please.
Okay, please. Yeah, so editorial, and I've been editorial board in very high impact journals and grant reviewers, inclusive for NIH, Wellcome Trust, and some of the other bodies. So I will ask the question.
I'm sorry, I can't hear you, Lola. I think you're muted.
Yeah, I said I'm very available for questions. Thank you.
Great, thank you very much. And we'll take questions in the discussion part. Thank you for that overview of your career experience and many kind of guiding principles and lessons learned. Thank you.
Thank you.
All right, and our next speaker is Dr. Evan White. If you could please share your screen.
Yes, a moment here. All right, hopefully we're seeing full screen slides.
Yes, that looks great. Thank you.
All right. So hopefully what I'll be able to do here is to continue on this theme of looking at career development in mental health research from kind of personal experience and perspectives from a very different background. So coming from the perspective of Native American research in the United States of America. And essentially what I'll go through here is, again, a brief background on my own perspective and training, some of my current research, and then hopefully through that, try to draw some more generalizable thoughts about current opportunities and challenges facing the development of mental health researchers, particular areas of strength and growth in the current pipelines that I have had experience with, and then drawing some final thoughts and takeaways and trying to tie it into a more generalizable experience about how to develop the careers of individuals looking to incorporate more research into their work in mental health, or individuals who are early in their career developing as researchers. So a couple of disclaimers I should note here. Again, this is from my own perspective, so it's not a comprehensive overview of all of the opportunities that I think are important for developing mental health researchers, but hopefully it's an addition to the conversation that we've been having today. Also, a bit about some of the language that's used in my research program. You might see terms like Native American. It's important to note that here there's a lot of collective terms that are used for the indigenous populations of North America. And perhaps one of the most confusing ones is the term American Indian. So for historical reasons, this term of American Indian is used to refer to indigenous populations of North America. And in most places, I try to refer to them as indigenous and or Native American. However, I work closely with communities here of different tribes, and in some of those circles, the preferred collective term is American Indian. So in those circles, I try to honor that preference. So I apologize for any confusion there that might arise because of that. So going into my own training and background, so I'm a member of the absentee Shawnee tribe of Oklahoma, and I'm also descended from the other federally recognized bands of the Shawnees here in Oklahoma, or that are now located in Oklahoma. And my professional training is in clinical psychology and a PhD. So all of my training is rooted in research around mental health conditions, both understanding mechanisms of development and maintenance, but then also prevention and treatment. And I've been a fortunate recipient of lots of great mentorship and training through programs designed for Native American students and targeted for understanding emotions and psychophysiology. And then also my clinical training at was primarily done at the Medical University of South Carolina in my predoctoral clinical internship. And currently I'm located at the Laureate Institute for Brain Research in Tulsa, Oklahoma, where I'm really seeking to draw from both clinical neuroscience and cultural neuroscience frameworks to build an integrated approach towards targeting mental health intervention and prevention efforts, where we can be grounded and centered in Native American communities with a cultural perspective that's also informed and guided by neuroscience. So in thinking about the opportunities for up and coming mental health researchers, I'd like to first acknowledge that I'm very thankful and aware of the privilege that I've been afforded through opportunities and trainings with various fellowships and training programs throughout the year that have prepared me to pursue mental health research. And so I'd like to kind of summarize some of these opportunities that I think are available, particularly for individuals here in the United States that are seeking to work with underserved populations or communities. And obviously the suite of training grants from NIH are important, but also seeking funding through particular foundations, such as like specialized topics, and whether it's Brain and Behavior Research Foundation or the American Foundation for Suicide Prevention, and trying to connect early career trainees with opportunities specific to their research interests is I think, a key step in for developing research for a couple of different reasons, which we can talk about it in a little bit, but also thinking about particular training fellowships. So one that I've been fortunate to be involved in is the Native Children's Research Exchange, which is funded through the National Institute on Drug Abuse. And you can see a picture of myself and some colleagues there at our training. And this is targeted at getting some mentorship from around the country from individuals who have successful research programs in community engaged work with Indigenous populations on these topics. And so here you can get hands-on experience and mentorship from individuals who have really been successful at building a career in this area, which I think is a really critical stepping stone for early career researchers. Of course, technical trainings are extremely important. So having opportunities in addition to formal education to get training with particular research methods or particular research areas that will really enhance an individual's toolkit to be able to conduct meaningful work. And then most recently, one of the opportunities that I've been involved in is the Mosaic. And this is, I think, maximizing opportunities for scientific advancement. Oh, I'm terrible with the acronym, but the Mosaic program has a K99 R00, which I'm currently in the R00 phase of my own particular project. But they also have a partner UE5 center grants that my particular partners through the American Academy of Medical Colleges. And this partnership basically provides individual research funding through the K99 R00 mechanism, and then also funding to an organization that provides a kind of cohort structure. So I'm paired with other recipients of this award that also then can coordinate professional development activities, networking, and mentorship opportunities. And I really think this is a great extension of the Career Development Award by providing some scaffolding and infrastructure around the career development outside of just the individual training plan and research plan that comes with the K Awards. Now, thinking about some of the particular challenges within this area, some of the ones that came to mind from my current experiences are really centered around kind of the current state of increasing competition for either the same amount or fewer resources. So oftentimes we're seeing budgets dwindling or inflation driving, resource acquisition down, but then also more and more individuals and opportunities for expanding mental health research, really vying for that limited resource pool. And then a current advance, as we've heard throughout the day, is the need for interdisciplinary team approaches, which I think is critical to impactful research, but it does create an interesting challenge and obstacle for early career researchers who are seeking to really develop their own expertise, but then also learning to integrate that expertise on the fly with individuals from other backgrounds can be a particular obstacle. And then, so coming along with that is the challenge to identify and connect with mentors for those interdisciplinary approaches and collaborators as well, to really build a team science approach. Again, that's just another demand on time for these early career folks. And then a particular interest of mine is advancing engagement with community-centered work to address health disparities. So here it's really about bringing the affected communities and individuals for whatever mental health difficulties that we're trying to address with our research, bringing those voices into the research process and centering the needs and strengths of the communities in our efforts to address concerns. Again, a very impactful and important part of the research, but it does create unique and complex challenges for researchers in this endeavor. So in addressing some of these challenges, I'd like to talk about some areas that I see as particular strengths of some of the existing efforts and pipelines that I'm involved with, and hopefully talk about ways that I think these could be grown, and then hopefully to draw some parallels that may be relevant for some of the other efforts to advance this around the globe. So one area of key strength that I've noted, and an area that I think should be enhanced, is the early engagement of research opportunities. So we've heard a bit about this and thinking about preparing for a research career and things of that nature. I really think engaging trainees at an early stage with research opportunities to get hands-on engagement to learn about the real process of research and finding ways to integrate that into undergraduate and potentially even secondary education. Some of the efforts that we're involved with here at LIBOR are what we call the Dream Neuro Fellowship. So this is a 2-year fellowship where an individual with a bachelor's degree is able to come and get some protected time to do their own research and develop that with a mentor here, in addition to functioning as a research assistant in a lab. And then we also
just to let you know, just 1 minute left, please. Thank you.
Okay, I'll get through this quickly. So we also have a summer internship where we provide some targeted development here. And then I believe that the cohort approach from the Mosaic K99 that I mentioned earlier, I think that approach could be applied more broadly to early career investigator awards. So thinking about ways to create this kind of cohort structure for fellowship awards at the F31 and F32 level, perhaps even other K awards like K08s and K23s and such, I think would be a nice scaffold to the career development plans that are in place. And I think institutionally, we can think about how do we use our internal training programs, our kind of speaker series to attach elements of that are particularly targeted towards developing early career researchers, whether that's individual meetings with visiting scientists or maybe directly taking into account early career researchers' preferences on who to bring and connect them with in the field. And I think also then for the later stage faculty, creating institutional incentives for those faculty to engage in mentorship of our early career researchers would be a way to use the levers we have at our disposal. And then also protecting time for meaningful research engagement. So quickly, I'll just throw up my final thoughts here on early engagement and continued development. Particularly, I wanted to think back to the Q&A from panel 1. and think about increasing our capacity for training the next generation was mentioned by Walter earlier. I think this is really important, and it's tied into incentivizing, experienced faculty to mentor younger researchers and finding new opportunities to do that. And then also thinking back to engaging individuals with lived experience, both I think with mental health, but also broader end users of our research, the people that we're trying to impact, finding ways of bringing those individuals into the research process is extremely important. And as they noted, engaging with people, even policymakers, takes a lot of time. So finding ways institutionally as researchers to encourage and support and protect the time for especially early career researchers to foster those relationships and forge those connections will be really
Dr. White, thanks. I'm going to have to pause there just for we'll get more time for questions, but
absolutely. Thank you.
Those are all really excellent points, though.
Yep.
Okay, so we'll open things up now for questions that people can add to the chat. And I'll place the speakers here. All right, so I'll look in this. There was a comment in a question that was made early on, and I think it relates a little bit that maybe sometimes we hear a lot about mental health stigma in the community, but there were a couple notes of how difficult it is for mental health researchers in terms of stigmas that they face, challenges, and so there was a bit of a question of burnout and how best to deal with that. And one thing that was mentioned a lot in this panel and previous panels as well is how multidisciplinary the field of mental health is, and all the things you're expected to be able to do and be very good at, and they take so much training and supervision and mentorship. And I kind of wonder how these interface a little bit with the challenge of being a mental health researcher. It seemed a little bit that one of the largest pressure points was that kind of early career stage, the postdoc faculty transition. And I was just wondering if anyone here had comments on how to deal with burnout, how best to support researchers at that particular time, and are there particular kind of programs or ways to help people at that stage?
I can take a first shot. Yeah, how to support people at that stage. I would say that even within larger grants, capacity building efforts go a long way in helping and building confidence in early career stage individuals. Because on some of the projects that I've been part of that has had maybe just small grants like $5,000. I mean, we had that for the large NIH project that I did, and then some other ones like that. So those things, they provide some kind of seed grants that can help people that can help very interested younger faculty members to actually try their hand on projects they're interested in, and which they can actually develop later as some kind of background work for a larger funding opportunity. So capacity building program, I think, is very important.
Thank you. Anyone else want to address that at all, or?
Yeah, I can take a swing at the burnout prevention aspect of this. I think that the burnout that I've seen, or that I've dealt with or seen in my own experience, really evolves around trying to maintain the increased responsibilities in addition to what research efforts here. And so we've heard it discussed here as resources or small seed grants or other types of funding. And essentially what I really think it comes down to is finding ways of protecting time. And although the easy kind of route to take here is funding, right? Let's pay for more protected time. But I think that as more policy-minded institutes and things of that, is finding creative ways to incentivize even the institutions that these individuals work in to protect that time. So what ways can we provide the institutional infrastructure that allows early career researchers, to be able to focus on what we think are the critical aspects of developing a line of research, whether that's, protecting time for engagement with policymakers, stakeholders, community members, or affected individuals. And then also administrative support for navigating some of the institutional infrastructure that's critical to funding. So we heard a little bit earlier about the kind of dense instruction manuals for applying for funding, particularly from NIH or other funding institutions. So finding ways to connect individuals with those types of administrative supports within their institution, and really building those up, I think relieves a lot of the pressure that might lead to burnout early on.
And Dr. Paul, if you can just add one bit onto that. Yeah, I think especially mental health compared to all the branches of medicine is, it's relatively young, and there are a lot of unknowns, which sometimes creates a lot of uncertainties in people from both the people who need actually help, as well as people who are providers in terms of healthcare professionals. So I think one way that really worked for me is to have a team of people with complementary skills. It's very important. I mean, very often in early stages of your career, you're asked to wear multiple hats, and you're not necessarily an expert in all of those. So if you can have, you can build a team with people with complementary skills, and the level of burnout that you face probably will decrease over time. Yeah.
Great, thank you. I'm curious, a lot of those, that seems to revolve around institutional support, and I think mentorship, which are very important and were stressed quite a lot. Are there a way that collaborations can facilitate some of these aspects as well, or help with providing extra resources, extra people to talk with, extra experience? Or does that actually create a bit of a burden sometimes because you have to apply for some of those things? So it's actually, it sounds great once you get it, but the work to get it is very challenging and should be alleviated. Any comments? Or
I think that's a great point, in that oftentimes the solutions that we propose to these types of things are also work in and of themselves. But I think that's the line of thinking to be very effective at addressing these types of issues, because then we've moved the conversation to how do we effectively, address the direct obstacles, but in seeing, okay, maybe collaboration might be an avenue here. It gives us a new suite of tools to then think, okay, what are the burdens that come along with collaboration? Is that making connections across the field, networking opportunities, seed grant funding, those types of things that come along with building those connections give us a new area of solutions to support early stage investigators. One thing that's come up that I thought of when we're mentioning team-based science and things like that, oftentimes the researchers, particularly early in our career, I know it was true for me in developing a lab, I haven't had any training in managing personnel or the logistics of a lab that are important to a functioning research team. And so I also think having targeted resources and trainings on personnel management and directing a team of individuals, regardless of the research program, are important as well, because oftentimes burnout can be rooted in just the navigating, leadership role in a team-based structure.
Yes, actually, I was struck earlier when I kind of came into some of this thing about capacity building. I was often thinking of it in a data science, data management, kind of that technical sense. I think most of what I've heard in this panel and earlier panels, a lot of it is about public engagement, management of a lab, grant writing, interacting with government officials, and that's a very different kind of capacity and a huge set of skills, and frankly, to me, seems much more difficult than some of the data management ones. So is there something there, as you look back on your own early careers and as you're kind of supervising people now and mentoring, are there things that you look to do that you wish that you had or someone had told you when you were going through and now you feel you can make it easier? Or are there things that as you're mentoring and supervising now that you find are the biggest challenges for those kind of early career people coming up?
Let me take that. So, I mean, this is an ongoing challenge, right? I mean, having to manage, the grant, not just the scientific aspect, but also the administrative aspect. Having to deal with the, financial administration of the grant, unless you have institutional support, which can, help you with that, you will actually spend a lot more time on non-scientific aspects of your project. So I mean, in the end, you would feel more burdened than actually having to do good science. So now looking back, probably if if we can also probably budget more, if you can't get institutional support, put that in the budget and get human resource to actually help you with that aspect of the grant management as well. So,
are there any other things, if you had one thing that would make your life easier in your work now, what would that be?
Yeah, that's true. I think institutions, particularly institutions with strong grant management office, they are able to actually provide a lot of support, because when Dr. Hola was talking about, if you're not careful, you spend a lot of your time doing administrative things as against doing scientific things. That's actually very true. But with very good support and from the grants office in one's establishment, I think this can be easily navigated. And in terms of what one can do to really improve others coming behind, people that we are mentoring, one of the things that I found very, very important is to actually, I did notice that, I mean, just like I said, I struggled a lot with thinking I wasn't, with lack of confidence. Is actually something that a lot of young researchers struggle with. So in terms of helping people to involving them in your work and helping them to, I mean, giving them opportunities to lead sections of papers and things like that, I think it can go a long way to help build people's confidence, and it can help them to know that this might be daunting, but it's something that is very doable. Yeah.
Well, thank you very much. I've really learned a lot today and appreciated all your observations and stories and lessons learned to be shared. So thank you all for participating. And now we'll head it over to Leo Cabillos for the final wrap up.
Thank you, Paul. Can you hear me?
Yep.
Well, I don't even know how to do a wrap up after this wonderful conversation and so much exchange. First of all, I just want to say thank you to all of you who joined us for these past 4 hours, to the team that organized this workshop, and for the folks at CUGH. All of us that are here, we are here because we deeply care about people, fellow human beings who are struggling with mental health conditions across the world, in low-income settings, low-income countries, middle-income countries, and high-income countries. That's what we're here for. And our role at NIMH is to support good research, but good research cannot be done without researchers. So our success is supporting you guys, supporting your success. Today, we heard a lot of good exchanges, particularly around some things that have worked very well at the organization project level. We heard that in the first panel. And in the second panel, we heard personal stories, insights, and even tips that have worked for these individual researchers that are moving forward. But I think one of the lessons learned there is the road is challenging. It's not an easy job. It's not an easy path as we move forward, particularly in low and middle income countries, even institutional as well as other constraints, even all the potential challenges at the hard skills level that Paul was mentioning at the end, but also some of the soft skills that could be missing in some institutions as well. We acknowledge them, we understand them, and our goal is to help researchers overcome them. We've designed this program with the intent to foster and initiate a conversation around capacity building and what we can do and what we can learn. But of course, this is just a tip of the conversation. This is just the beginning of it. I was very, very I was very moved, I guess, but what Lola Cola said about lack of confidence at the beginning of her career. Lola has been showcased by Lancet. She's the person that has moved forward in her career beautifully. And yet she shared that it wasn't easy for her at the beginning. It is not easy for many of us, for many of you at the beginning, but we're here to work with you as we move forward. I want to leave with you two upcoming events in addition to the ones that Susie, Colleen, and others have mentioned. This event is taking place next week. I'm going to put it in the chat box right now, if I can find the chat box. This event is taking next week on Thursday, April 13th. It's organized by Fogarty. They will celebrate the 20 years of the D43s, and they will deep dive in the D43s. We heard a lot about the D43s throughout today. So it will be, I would like to invite you to join that activity. And then many of you may be aware of a tool called Reporter. Reporter is an online site that you can access and check what NIH and NIMH and other of the NIH institutes have funded. That can give you an insight of where the funding is, where it's going, who is getting the funding, what universities are getting it, because those names can be important as you try to find collaborators across the world. So that is also a tool that you can use at your disposal. Thank you everyone for joining us. I wish you a great morning, a great afternoon, and a great evening wherever you are. Have a wonderful rest of the day and evening. Bye-bye.